Welcome everyone to MPHA's special joint presentation, the Racial Equity Impact Note meeting. This is put on by MPHA's Health Equity and Policy and Advocacy Committees. So it's really exciting to be able to have this presentation today, very timely. Just a quick note for those who are not familiar with MPHA, because I know we have quite a few non-members joining us as well. MPHA is a statewide independent public health association, and our work centers on professional development, education, advocacy, networking, and a whole host of other opportunities to make public health stronger in Minnesota. So without further ado, I'm excited to turn this over to Erica Fishman, one of our Health Equity Committee co-chairs.
Thank you for this opportunity. These are just a few Zoom reminders that please mute your microphones when you're not talking. You can have your camera on and off. We ask that you put questions and comments in the chat, and then the presentation, as Mary said, will be recorded, but the discussion will not be. And now I'm going to read our MPHA Acknowledgement of Ancestral Lands. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakotas and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial, and we are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and U.S. governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors, descendants, as well as the land itself. And then I'm just going to go right into introducing our topic and the presenters. As Mary said, we're going to be talking about racial equity impact notes. Racism has always been a public health crisis and requires structural and preventative solutions. Recognizing the political and policy determinants of health, our strategies must embed racial and health equity into policymaking and governance. We're glad that so many of you are joining us today for this discussion about why and how a racial equity impact note could be established in Minnesota. Our presenters today are Vayong Moua, Director of Racial and Health Equity Advocacy for Blue Cross Blue Shield of Minnesota, Nicole Donoso, Policy Organizer for Voices for Racial Justice, and Representative Liz Ryer, who represents District 52A. And I'm going to pass it over to Vayong to start the presentation. Thank you for joining us.
Thank you so much, Erica, and to MPHA for dedicating space and time for this topic. I just want to first acknowledge that even spotlighting the racial equity impact note is a indication of how we are seeding racial and health equity into the practice of public health. And in my view, a reason why we're in this predicament is that racial and health equity hasn't been centered and built into the way we think about policymaking and about public health and about health plans. And so I say this with respect to the field of public health, and this applies to government, and this applies to Blue Cross and to every institution. So thank you so much for centering this topic. A fair heads up, I tend to speak in a non-linear fashion. I do have some slides, even though every time I promise myself I'm not going to do slides, I do have a few just to ensure that we don't bypass any fundamentals around racial and health equity. I'm really excited today to be with you all and to hear from my fellow panelists, Nicole and Representative Ryer. These are two human beings who I have great admiration for. My role today is just to be a setter, and I have a great outside hitter and middle blocker and weak side hitter. I used to play volleyball, so excuse the metaphors there, but I'm looking forward to our conversation. And please, if you have questions, comments, complaints, especially praises, please put them in the chat, and we'll try to field them in real time as best as we can. Erica, I'm going to switch to my screen here if I can. Let's see. Do I have that option? I'm trying to look for. Okay, here it is.
You should, yes.
Okay. So thank you for that introduction, Erica. I'm the Director of Racial and Health Equity Advocacy at Blue Cross and Blue Shield. But I wanted to make sure that you had a sense of my anchoring and roots in this work. I'm the child on the right side here in my mother's arms, landing in Eau Claire, Wisconsin. And I, no matter if it's a small talk or a long conversation, I always want to make sure that I pay tribute to my ancestors, that I acknowledge the sacrifices and the strengths of those who preceded me, both in terms of my ethnicity and in terms of my values-based ancestors. My mother was a what we would call today a community health worker for 25 years for the Eau Claire Public Health Department, and my father worked for the mayor's office in Eau Claire. And so in many ways, I was forged out of civic engagement and public health. Moving on, let's see if I can. I just wanted to acknowledge that we celebrated the life of Dr. Martin Luther King this week, but I think all of us here are beyond a one-day celebration. I think we recognize that it's important to weave in the guidance and the virtues of the civil rights movement, those who are in the spotlight and those who are hidden figures in the movement. This is one of my favorite quotes from Dr. King. I would encourage all of us to consistently revisit his letter from Birmingham jail. I think that is one of his most compelling pieces, and I'll just read this really quickly to make sure I'm not overlooking any accessibility dynamics here. I have almost reached the regrettable conclusion that the Negro's great stumbling block in the stride toward freedom is not the white citizen's counselor or the Ku Klux Klaner, but the white moderate who is more devoted to order than to justice, who prefers a negative peace, which is the absence of tension, to a positive peace, which is the presence of justice. For me, this sentiment really captures what we call often in public health the Minnesota paradox, right? Why does Minnesota have high peaks, low valleys? Why do we have some of the worst racial and health inequities in the entire country? And in my view, it's no accident that this is the case for Minnesota. And the murder of George Floyd, all the exacerbated inequities that COVID-19 illuminated for us, for me, I think it is no wonder that Minnesota is in this predicament. And this presentation today, I think, is an attempt to proactively get ahead of that, to make sure that racial and health equity isn't an amenity, isn't treated as an afterthought, isn't just goodwill, but it is built into the way we analyze, value, and implement sound policy. I want to quickly get through my remarks so we can hear from our great panelists. I'm known to be somewhat verbose, and so I want to make sure these kind of epiphanies are addressed up front. And if I don't touch upon them, at least if they're in the slides, and we can always follow up offline on any of these key tenets in racial and health equity. First and foremost, I just want to make sure we all recognize that all the headlines, all the data that we see about racial and health inequities, whether it's in healthcare or the workforce or education, what science and community wisdom tells us is that these inequities are primarily preventable. They're not inevitable. It's not a natural bell curve. They're by design, and they're created through decision-making and through a political process. And I don't mean partisanship. I mean through power, privilege, access to resources. The other tenet here I'm going to highlight is that I feel like what compounds these inequities is that we've been throwing programmatic or purely educational solutions at a structural problem. And so we need to match the magnitude of the problem with the magnitude of the solutions. And then to the heart of this conversation, this isn't a silver bullet to address racial and health inequities, but in my view, it's a promising practice, and at least tries to seed racial and health equity into governance across sectors. Certainly today we're talking about the legislative process, but this applies to a nonprofit, a foundation, a health plan, a family. And so what we're really trying to present today is how can we seed racial and health equity criterion, principles, and analysis into key decision making. So I really went over my time. I want to quickly move on to Nicole here. This last slide here, I think everybody has seen some version of this a million times. And again, this just confirms that these inequities are decided upon, that they're socially and politically constructed. Great. Well, the last thing here, and I can put this into the chat too, these are some links to resources for the policy wonks, for the researchers, for those who really want to dig into this a little bit more. I'll put these into the chat so you can follow up on the context, some of the organizing behind racial equity impact notes, and some of the findings thus far. And so with that, I'm going to move on to Nicole. And Erica, I think, just kind of introduce us broadly, but I just want you to know how I know Nicole. I'm sure you could Google that or read her bio. But for me, Nicole really represents an advocate, a change agent who really connects the dots between her personal biography and the history that is occurring around her. She is connecting personal, interpersonal racial justice with structural change. And I think that's a link that isn't examined or done enough. Her work really spans the work of connecting democracy to public health and civic engagement to advancing racial justice. I won't expand on it too much. And Nicole, please forgive any kind of like over-interpretation on my part, but I want everybody here to know how much I admire the both of you, because although we're talking about racial and health equity and policymaking, what surpasses that, in my view, is racial and health equity in organizing, in community partnerships, and in how you do the work. And so with that, I'm going to pass it on to you, Nicole. I'm going to stop sharing if I can. I don't know, did I get out or not? Sorry, I should be a little bit more tech savvy here.
I can start if you want me to.
Oh, please, Nicole. Okay, there we go.
There we go.
Yeah.
So hello, everyone. The admiration is mutual, but John, thank you for the invitation. Happy to be here. Yes, I'm Nicole Donoso. I work for Voices for Racial Justice. I am the Democracy and Policy Organizer here. I came in Minnesota 11 winters ago, and it's been beautiful but challenging journey to adapt to a new culture, new language, and especially a new set of policies. I joined Voices 2 years ago, and I have the honor to work in an organization that is trying to change the structure of how policy is being made in Minnesota. We are trying to bring those racial justice lenses to the way how policy making has been done. So something that you mentioned, but John, I think is important is like, okay, why is it important to bring racial justice lenses to policy making? Well, because what you said, the Minnesota paradox, Minnesota is one of the best states to live for white people, but is one of the worst states to live for BIPOC communities. And we need to take this seriously. Like, the disparities are enormous, and we need to start taking a step forward to address those. We are connected to each other, right? My liberation is attached to liberation. We are healthy. Minnesota is healthy. BIPOC communities are healthy. So it's very important to start taking steps towards addressing those disparities, because disparities in a state should not be a norm. This should not be, oh yeah, we have disparities in Minnesota. We should seriously take into consideration how we address those. And we believe in Voices that a way how we can address these policies, these disparities in policy making process is with tools that actually supports policymakers, advocates, and community organizers to bring those racial justice lenses. So how we do that? Voices have built tools, and this is in support with other organizations, advocates. So it's not just a merely Voices for Racial Justice work. This has been years of work of organizers that they have worked together to build a tool that supports leaders in bringing those racial justice lenses into policymaking spaces. So I'm going to show the tool. I'm going to share this I'm going to share my screen so you can see it. Let me know you can see it now. I think you can see it now, right?
Yes, we can.
Yes, we can.
Awesome. Thank you. Yeah, I couldn't see the faces. So this is a tool that we call the Racial Equity Impact Assessment. And later I will talk how this tool is connected with the Racial Equity Impact Note. But think as the Racial Equity Impact Assessment as the framework, the way of thinking that we want every policy making spaces to start doing policy. So we want that every leader, everyone who is in a policy making space, start asking these 5 questions. The first one is, who is most impacted? And engage those specific communities in their analysis. This question really talks to identify who is the most impacted. And once you do that, engage those. But this is calling for actually building mechanisms of building trustworthy mechanisms of communications. Engagement, it's about time and effort and energy and love. So BIPOC communities feel welcome to contribute in a meaningful way in policymaking spaces. The second question is, what is the disparities being addressed? Identify any current disparity and name the racial equity purpose of the policy, if any. This is really thinking about the disparity that is currently and how the policy is going to change that disparity. The third question is, how will the proposed policy change the situation? Explains what the proposal seeks to accomplish and assess whether the policy can achieve any identified equity goals. Every policy has an effect on communities, especially communities based on race. The 4 questions are there potential negative impacts? When we craft a policy, we need to think about the potential negative impacts of BIPOC communities and really dive deep on what is a negative impact. Negative impact of health, negative impact of access to education, negative impact access to food, resources, to transportation. And then the 5th question is, can the policy be sustainably successful? This speaks to ensure the adequate funding, implementation strategies, and accountability mechanisms are in place. Often really good policies are passed that are trying to address racial justice, racial disparities, but often these get low funding or the funding is out of these policies. So this is make sure that you have the funding and also the organization that maybe is going to do the auditing, and how often you're going to do the auditing so that policy can sustain and survive through time. So I'm going to stop sharing my screen. Also, I know we're going to share this document after the discussion has been done. So you're going to have more time to look at this in a more meaningful way. So something that, so in transition to REIN, the racial equity impact note is one example of application of how to conduct a REIA. The REIN, it's based on model on physical notes, and it's a data-driven approach and supports legislators to measure the potential equity impact of legislations. So it's very specific. So something that I want you to leave is REIA as the framework, as the way of thinking, and REIN, the racial equity impact note, as a specific example of how to conduct a REIA in a more meaningful way. I will leave it there, but John, yeah, so back to you.
Thank you so much, Nicole. And I really appreciate the point that you're making around us not treating them as the same, and that a REIA, as you emphasize, is really a more philosophical, values-based framework, and allows for more rigor and in-depth analysis and engagement. And the REIN is a very specific policy tool, right? And so I think there's an important distinction, and I think it's important that even as we explore a REIN, we need to make sure that it's never treated as a proxy for the need to do more nuanced, complex engagement and analysis. Nicole, you're too busy presenting and speaking, but I wanted to acknowledge a question in the chat. I know Matt Flory is helping us field questions too, but I think it's a great one. Dr. Frizzot, forgiveness if I mispronounce your name, really brought up the limits and some of the tensions around the term BIPOC. I think language is always evolving, and we need to be comfortable with non-closure. But I think it's really talking about the exclusion of American Indians. And as an Asian American, I think we've been examining this term too, right? And we do not want to perpetuate the inequities that we're trying to address through our own terminology. But I wanted you to see it and give you a chance to respond to it. I can read it too. I'm sorry if it's not up on your screen. Yeah. But it says, to Nicole, American Indians are not BIPOCs. We are a political group through tribal governments. By using the term BIPOC, you are not including American Indians.
Yes, so there's been tremendous discussion about what to use in terms of alluding to communities that are not essentially white, right? And different organizations, when we use BIPOC, this is something that we need to revise, but we were thinking also in indigenous communities and Native communities in Minnesota. This is something that is changing, and voices, we're addressing those needs because indigenous, as you say, are not identified as a BIPOC. So sometimes we use people of color, but this is something change. But yes, I think we need to know to address those, the way how we approach those communities.
Thanks, Nicole. I'm going to field this question from Dr. Frizzot really, really quickly, actually in the interest of time, to slow down, to make sure we don't.
Certainly. Sorry that nobody understands that we are a political group. We're not a racial group. We are not noted as indigenous, thanks to the 2020 census, which includes Mayans and Aztecs under the category American Indian Alaska Native. So we have a huge data problem, but it's respect. And we are not people of color. We are not a minority. I don't call anybody, any race a minority. You can just put population after the word minority and take care of that. But anything that's degrading. But so just remember, we are not a racial group. So if you're doing research, you need to know that. And we're working on trying to get the law changed. Of course, the Census Bureau didn't ask any of the tribes. By law, they're required to do so. So we're fighting it. But it's a big mess is what it is. So I appreciate being able to explain that.
Thank you, Dr. Frizzell, for bringing your vigilance and discernment. We need to continue to challenge each other to evolve our understanding and the way we engage with each other. I know that that's probably just the tip of the iceberg, and we welcome ongoing conversation beyond this presentation. Representative Ryer, we're going to call upon you next, and I know that you just came from a dentist appointment this morning, and but I see a beautiful smile, so I trust it all went well. For those who don't know you, you are also my personal legislator. I am a proud constituent of yours. Your district also covers Blue Cross and Blue Shield of Minnesota, so there's a twofer there. Perhaps most of all that I want to lift up about how I know you, besides having tea in my home and having you be with my parents and my own children, tells me that the way you engage with community is authentic and in-depth. But I see you as a racial and intersectional equity champion in all facets of your life, certainly as a legislator, but in just the way you live your life. I would welcome how you want to share and introduce yourself.
I just had to thank you, Vayong. I had to read this comment because I saw my name. Not only does Representative Ryer see her dental provider, she works to be sure more Minnesotans will too. And I have to say, to me as a lifelong dental phobe, I really appreciate being able to lift up good dentistry and the importance it brings. But that's not what we're here to talk about today. And I want to first thank people in the discipline of public health, the work that you do day to day with people in our community, so all the practitioners and the association for setting up this event. I want to thank Nicole and Vayong for letting me be a partner in this conversation. It is just the preparation and the issues that we're facing are so important to discuss that I am really grateful to be here to represent the legislature and the work that we're doing to build accountability and to fight the cultural barriers to seeing all people as equal participants in our processes. I will focus more today on the opportunities and less on the barriers, because I think that's how we drive change. But I am not unaware of burns that are faced. For me, so I'm a legislator. I'm in my second term. I represent parts of Eagan and Burnsville. I have been on the health committee for my entire time, as well as capital investment, helping to drive the nearly $500 million that went to community organizations and working very hard to channel funds to the Indigenous community, the Black community, immigrant communities, queer communities, people who have been excluded from the capital process. And if you can't build the structures that you need in your life, you cannot get your needs met. And so we've been working hard under Chair Fu Lee's leadership on the Capital Investment Committee. And I've also focused on issues related to housing and preventing homelessness. I'm doing that because, as I see it, we have the structure in our country that we white people, especially white men, designed. And it's working and has to now has worked exactly as designed. And we've seen the outcomes. Vayong already spoke about the disparities, and we all know about that. We also have such an system of inequity around who is seen as a whole person and a safe person to be around. I heard a quote on the radio today. It's from a new movie, The American Society of Magical Negroes, and this just jumped out at me. What's the most dangerous animal on the planet? The answer is white people when they feel uncomfortable. And when we recognize that as white people, then we can say, how do I recognize that privilege? How do I tread lightly in spaces? How do I make sure that we center the voices that need to be centered? And so for me, talking in the public health space, to me, and as a legislator, talking to my fellow legislators, that's what the culture change I'm trying to bring about. I think the REIN really gets at that. Or no, the REIA gets at that. Sorry, got my acronyms mixed up. Because it does look at a cultural shift on all the big picture of building cultural awareness and understanding the impacts of the specific legislation that we're coming forward with. I know from my experience that sometimes in a committee hearing, I might ask, have we thought about how this is going to influence the Black community, the Indigenous community, other communities? People will either say, no, we missed that. That's a great idea. Or you can tell they just don't care. Either way, it's not embedded in the process. And we could have 50 people who think the way I do, and it's still not embedded in the process. So when we're not there anymore, and I'm not always consistent, I mess up and miss, the process needs to be there to correct us and keep us on track. So that's what I love about the REIA and the REIN. From the perspective of getting the work done, right now, there have been 3 bills, either active or active in past sessions, that work to bring a REIN into existence. One was heard in 2021 in the State Government Committee. It was authored by Representatives Samantha Vang. And then there are 2 this session. And so I'm working with the authors of those to see how we bring those pieces together, what we need to do to get a hearing for it. We've got some constraints this year. We have a very short session. We start February 12th and we end scheduled May 20th. So not much time. And we know because we made so many investments last year, you've probably heard there's not going to be much of a cash bill this year. So we need to be saying, what are the successes that we can get? Where's the progress that we can make? What's the groundwork that we can get laid to be ready to ask for more funding? Maybe we can get some seed money, but for more funding in a budget year. Because we need to close the gaps. We've got our fiscal notes right now, but they are inadequate. We need to find ways that we can bring both the REIA and the REIN into the legislative culture so that we're not just doing it as a tactical check the box, which is my one fear for the REIA, for the REIN, because we need to have the REIA mindset. And Vayong, I can talk all day about this stuff too, so I'm going to stop now and go to questions.
Well, thank you for kind of again balancing and distincting REIA and REIN, and for really pivoting us to think about the opportunity and the assets we have at hand. I know we're so guilty of moving on from what has happened in last session, and I just want to acknowledge, like, last legislative session there was a mountain slide of great progress across policy domains. And we have seemingly prime political conditions, both in policymaking roles and as well in and I would argue even more a more ripe and primed community to act upon kind of that progress. What do you see as your role as a legislator? And I'll extend this to you as well, Nicole. I was remiss in asking you this, but like the role of racial justice rooted organizations. And then if I would love to hear what you think is the role of public health and organizations like Blue Cross, because we want to make sure that we're not idle sitting on the sideline. So both you and Nicole can both kind of respond in your own way. Yeah.
Well, I'll hop in first, and so that then Nicole, because there'll be kind of a question there for you. From my perspective as the legislature, we should be a conduit of the ideas and the knowledge of the communities who are affected by the work we do. And so none of us are going to have all of the answers. We have all our own lived experience and institutional organizational knowledge and wisdom. We don't all have all of it. And legislators, there are so many things we face. We must rely on the community. And I think sometimes that gets forgotten in the press of things, or we're problem solvers by nature. And so we think we can solve it. So we need to be reminded and remind ourselves of our role. So my question to you, Nicole, is, and to you too, Vayong, is what are the barriers to that? How can we as legislators make the process more accessible for you? What do you wish that we did, or how do we open the doors for communication?
Absolutely, I can start. So I think it's, as you said, the people most impacted by an issue are the most knowledgeable about it. They already know sometimes the solutions, and I think they need a voice in the policymaking space. So it's important to build a relationship that is built in understanding, listening. So building mechanisms of relations. Just one time meeting is not enough to build a trustworthy relationship with I feel welcome to contribute in a meaningful way. I think it's important to have recurrent meetings to understand and get to know each other. As you say, like if each individual is a universe that we need to understand to really know how the policy that you're gonna craft is affecting that person. And it's very important to make to listen and to include those recommendations that the communities most impacted are telling you. And it's a relationship that is ongoing relationship, that it should start since you're crafting the policy, when you're implementing it, and then continue to build that relationship. It's not just one-time relationship, it's a continuous relationship that is going to continue building. I think another barrier that we face is language. There's communities that don't speak English. The language in a build is so difficult to understand. Most of people, like for example, immigrant communities, Spanish even is not our first language. Some indigenous communities have other language that is not Spanish, that is not English. So access to those things as well. Transportation. Legislators should meet the people where they are. Sometimes we don't have transportation to go to Capitol. Sometimes we don't have money to pay for a bus to arrive to the Capitol. Also, we are trying to survive, right? We are working. So I think it also be compensating the work and the knowledge that we contribute. So those are things top of my head. I'm going to leave some time for Vayong if you want to share more.
Well, I think Nicole had a very comprehensive response and just really what I'm hearing is to make sure that the onus of civic engagement isn't on residents and citizens and community members, but it's on government to make sure, from logistics to the physical kind of presence to the cultural aspects of democracy, to make sure that that isn't intentionally or inadvertently isolating. More specific to, I think, like Blue Cross and I'll take the liberty of speaking for MPHA too. I think calling upon us, right, leveraging your power, your positional power, to make sure that organizations like Blue Cross are accountable in their engagement and involvement, right? So like, hey, say like, and I'm not sure if Dana Erickson, my CEO, is watching, but you can say, hey, Dana Erickson, please come to the Capitol, and do you support declaring racism as a public health crisis? Will you support the enactment of REIN? You know, or me or whoever. I think that type of power is quite a privilege, and I think it's important for you to use it. Yeah. I'm seeing a pretty busy chat, and that's to me a signal that we want to make sure we have room for a group conversation. Before fully pivoting to kind of the group conversation, you know, I just want to leverage this combination of folks together. And Representative Ryer, you alluded to a pathway to potentially put together a racial equity impact note this session, live, real time, kind of combining and looking at previous efforts. What can we do in this space from our vantage point to support that, whether through like our networks, our knowledge, our relationships, writing a letter of support, or we just don't want to run ahead of you or be, again, idle on the sideline. So we want to make sure we're in sync with this very real opportunity and can support you.
Thank you for that. And because that makes such a big difference. If you just have a couple of people out trying to get something done, it's much harder than if other colleagues' emails are lighting up with support. And that there's a robust process to say, how does this work? I think having people who are engaged in the process of co-creation is important, and getting as many perspectives as is practical together to, you know, people are available. I think another is having institutional support. I think there's individual support, there's institutional support. MPHA, Blue Cross, the Minnesota Nurses Association, the MMA saying, this is a way that you can improve your policies. I'm thinking about it in terms of what does it look like, and Vayong, you brought this forward with Representative Kali Her. What does it look like if we focus first on health policy, which is closest to home for me? I worked at Blue Cross for 12 years. I've worked on the payer side as a consultant for more years than that. How do we build a healthcare system that addresses the well-known and unacceptable disparities, rather than, you know, and that we're taking that on and we're saying, we're going to do this policy. What's the impact? And that's an intentional part of everything we do in that committee. That's a place to start. And so if we narrow the lens and focus in, what does that look like? I also want to say for people to bring forward individual insights. Some of it's around having this process in place. Some of it's around having the right legislation brought forward by the right people who are seeing problems. I'd say one thing is that I think even going all the way back to problem definition, if it's done from the outside, we miss the mark, and then we're trying to solve the wrong problem. So Nicole, for you to come and say, we have an issue and this is what it is very specifically, rather than me saying, you know, I'm sitting here and I had a conversation with you, and so here's what I think the problem is, the issue is, and now let's solve it. You know, we could just be, maybe it's only 3 degrees off, but it's a critical 3 degrees. And I'd say that to the public health folks. You see a lot out in the field. You do a lot of things in your work. We saw creativity during the pandemic, where everyone just had to find ways to reach people where they are, as you said, Nicole. And I think it unleashed a lot of creativity. How do we make that the norm instead of the response to a crisis, so that we don't tamp down the energy that I've seen in the people trying to make the community a better place?
Thank you. Thank you, Representative Ryer. And again, just recognizing this is a 1-hour conversation to introduce and prime the pump. And I think we all recognize what is needed is a concerted campaign and collaboration across cultural communities, sectors, different disciplines to come together.